back to your Feel Good Breakfast Show, and you're just in time as we continue our health discussion on skin cancer this morning. We are joined by specialist dermatologist Dr. Suretha Kannenberg, and she is with us now with the Cancer Association of South Africa, TLC. We have coordinator Anthea-Lynn Lewis joining us too for this part of the conversation. Good morning.
Morning.
Anthea, I'll start with you. How common is skin cancer in South Africa?
As you know, it's one of the most common cancers worldwide. Here in South Africa, it's not as prevalent, but it does occur.
I think for a lot of people that have been diagnosed with skin cancer, a big question is, where do I go? What do I start? What do I do now? What would you recommend?
We've got the photo finder, which is not a diagnostic tool, but once you've got a mole and you've been for a photo finder, or if the mole is suddenly growing or the border changes or there's a color change, then it's the best to go to a dermatologist who will then advise you on what is happening with your skin.
And what are some of the treatment options available if you do find something, or if you do feel like you are of high risk for skin cancer?
So if you are just, obviously you would want to go to a specialist, so such as a dermatologist, and then the doctor will obviously examine all your, your whole skin. If there is something that they are concerned about, then in the majority of cases it would be surgery. If we are talking about things like squamous cell carcinomas, sometimes basal cell carcinomas, we can do cryosurgery, so that's when we freeze it with liquid nitrogen. And then obviously you would want to catch these things earlier rather than later, because if it's spread throughout your body, for example, which thankfully doesn't happen all that often with non-melanoma skin cancers unless it's neglected, then we would look at things like radiation, chemotherapy, those type of things are also. So there are treatments for it, but you really want to catch it quick. You want to catch it early. If we're looking at melanoma, then you really want to catch it early, because unfortunately the best treatment for that is still only palliative. It's not curative at this stage.
When it comes to early detection, because I know we always look at our moles and we kind of check out what we have, how do we know, and what should we be looking out for with regards to skin cancer, and just again with our beauty spots, and how do we know if those beauty spots are in fact moles or not cancerous or cancerous?
Yes. So if we look at moles, then we're going to look at the ABCDE criteria, which is what my friend here referred to. So A would be asymmetry, so that's from side to side, top to bottom, for example. If the lesion is asymmetrical, then the border, I like to say that it grows little fingers out, then you really have to be concerned. Color changes, yes, or various colors, so especially if there are things like blue or gray, black, red, those are the type of things that you really want to have checked out. D diameter, so bigger or larger than 6 millimeters, although that's not, because you do, not that important, because you do get small melanomas and then you get large moles, of course. But E, evolution is the most important thing to look out for. So is it bleeding? Is it itchy? Does it, or any type of changes, And if you are concerned about it, I strongly believe in the sixth sense as well. So if there's something if you feel that there's something wrong with it, then have it checked out. But then, of course, the non-melanoma skin cancers, we are looking at non-healing ulcers, so small little wounds that doesn't want to heal, especially in sun-exposed sites, then have it checked out.
So rather be safe than sorry, so
yes.
Get to the dermatologist. I know earlier we spoke about SPF in terms of applying sunblock correctly. For the South African sun, for the African sun, what would you recommend to be the right SPF?
I think for your fairer and lighter skin, we are looking at an SPF 50, and that gives you 4 hours and 10 minutes of protection. And the important part is, if you apply sunscreen at 8 o'clock, before 12, you need to reapply. And then when we move down and we go to our lighter skin, we're looking at an SPF 20. And how do you work out SPF? You take the 20, multiply by 5, which gives you 100. There's 60 minutes in an hour. You divide it in that. So an SPF 20 will give you an hour and 40 minutes protection whilst in the sun.
Okay.
But can I add something to that? I'm sorry to interrupt. I also just want to add that, remember, I was saying that we don't apply enough.
Yeah.
So really, if we're looking at that, then if you're applying a 50, you're only getting about 25 on your skin, the way we apply it.
Okay.
So it is very important to reapply. So the higher SPF you can use, the better.
And I also know
Always.
sunblock expires. I realized that this weekend when my sunblock didn't work properly, so I had to check it out. So just also check the expiration date.
If you do have any concerns, where can you get tested? Is there a local place that you can get tested for skin cancer or get screened?
Yes, you can come to our cancer offices. December and January is known as SunSmart. So we have the photo finder available. You can phone our office, make an appointment, and come and have any moles or any blemishes on your skin that is worrying you. You can have it looked at. And if there's anything to worry about, it will be referred to a doctor.
Excellent.
Well, ladies, thank you so much for joining us this morning. This was really a necessary conversation, and I hope you at home took something from this. I'd like to just give another special thanks to specialist dermatologist Dr. Suretha Kannenberg and cancer representative Anthea-Lynn Lewis for sharing their knowledge on skin cancer with us this morning. And the Cancer Association of South Africa urges all individuals to be proactive about protecting their skin, especially during this time as we head into summer. Make sure to minimize your time spent in direct sunlight and always wear sunscreen.